Hospitals across the country are still searching for ways to stop the emotional and operational damage caused by nurse abuse. And despite years of awareness, the abuse continues. Nurses are threatened, screamed at, intimidated, grabbed, hit, or verbally abused daily. Hospitals have reporting systems, response procedures, security protocols, counseling support, and de-escalation training. And yet many nurses still walk into environments where abuse is expected to happen again. That should force a harder question. Are hospitals still seeing this too late? Because the failure may not be only what happens after the incident. The failure may be that the warning signs, pressure, and escalation patterns were already forming before the incident occurred. Then abuse happens, then documentation begins, then support begins, but by then the nurse is already carrying the damage. Focus breaks, trust erodes, burnout accelerates, and the impact does not always stay inside the hospital. A nurse may leave work carrying fear, humiliation, anger, or emotional exhaustion home with them. What happens at work can affect what happens at home, and over time, repeated exposure can begin to normalize abuse itself. That is why nurse abuse cannot be treated only as an incident management problem. It is also a workforce readiness, operational stability, and prevention problem. The deeper question is no longer only, how do we respond after abuse occurs? The deeper question is, how do we recognize and interrupt the conditions that allow abuse to keep forming? Because the answer has not yet been fully found, and perhaps the right perspectives have not all been at the table, including perspectives from outside the hospital industry. Protecting nurses will require more than improving the current response. It will require new thinking, broader collaboration, and a relentless pursuit of prevention.